Lately, I'm seeing many patients in my practice and many patients in my functional practice who are always asking me, is it a food allergy or is it a food sensitivity? And what's interesting is that how the medical profession looks at food allergy and how the layperson thinks of food allergy, which to them is any adverse response to a food, is very different. In real medical terms, a food allergy is an immediate response to the food. It's confirmed by the demonstration of allergy antibodies called IgE. So you may have positive IgE antibodies that more of us are a sensitivity because you're not reacting, but you may have some non-specific symptoms you didn't associate it with. But when you consume that food, you're not developing life-threatening allergy symptoms. So my son is allergic to peanuts. He has allergy antibodies, and if he has a lot of peanuts, he's at risk for a life-threatening reaction. What I'm seeing more and more are people with a food sensitivity. They tolerate the food in that they don't have an immediate allergic response, but an ongoing inflammatory response that's deleterious to their body continues. There's no FDA-approved test for that. There's several companies that have food sensitivity tests, but they don't always correlate with each other because they're not standardized. What I try to tell patients is use those tests as a guide if it's hard for you to do an elimination diet. An elimination diet, removing inflammatory foods, the common ones such as dairy, eggs, corn, gluten, peanuts, processed foods, foods with pesticides, all of those are what are going to trigger a response. So by removing those foods and doing an elimination diet, that's the gold standard way to identify if these are the trigger. If after 3 to 4 weeks you are better, you then want to reintroduce the foods individually over 3 or 4 days to see if they reproduce their symptoms. We use a food inflammation test in the office. We use a food inflammatory antibody test in our functional practice to help identify foods to remove. But I always emphasize to the patient, ultimately, it's the elimination diet. And even in the allergy practice, when patients aren't sure they have a food allergy and allergy tests become positive, the elimination diet is still important unless they come in with a history of an allergic reaction and then the testing is just used to confirm it.